Hi guys, so today we are going to learn about basal cell carcinoma. It is the most common type of skin cancer, also known as rodent ulcer. A very common question, and it is a locally important points include it is a locally invasive cancer, rarely shows metastasis, almost nil metastasis, and its origin is that it arises from basal epidermis. And since these cells are also present near the hair follicles, therefore it can also arise from hair follicles. Therefore, another answer for the origin could be pilosebaceous units. Risk factors include UV radiation exposure, arsenic exposure, exposure to hydrocarbons, and coal tar. Usually found in people aged 40 to 60 years and more common in males than females. Another important point that its most common location is it is seen above the line joining angle of mouth and earlobe. This is a very important point. This is the most common location and it's a very important point. And if overall most common site is asked, then the answer is nose more than inner canthus of the eye. Its types. Now we'll move on to its types. First we can see that in the first diagram, first of all, one point to notice is that it's present on the nose. That is the most common location. The next thing is it is a nodular growth. So first type is nodular type. The second type is we can see that it does not have a vertical spread, it is mostly spreading horizontally, therefore it is a superficial type. Superficial spreading type. This one here shows growth that has both nodular and cystic, which is very inflamed. This is known as the nodulocystic type, and this shows morphoic type. This is slightly indented with which is known as the ice pick type. These are the main types, and the most common is nodular type. So this must be remembered. Nodulocystic is also very common, but the most common type is nodular type. Also, it can present as ulcers, and the most common type of ulcer, as we already discussed, is also the rodent ulcer, which is also located mostly in the upper part of the face. To approach the patient, then after seeing the patient in the OPD, we go for the investigation. The investigation choice is a wedge biopsy, and characteristically we see palisading pattern, which is a very important finding. This must be remembered. Certain high risk features include size, large size, greater than 2 centimeter, characteristically defined, and sites where it can directly invade the cranium, like the eye, the nose, and the ear. Also, recurrent ulcers, recurrent carcinoma is also a high risk feature, and if at all it shows metastasis, that is also a very high risk features. Management of the disease includes two modalities, that is either we can go for surgery or we can go for radiotherapy. It has a good prognosis because it does not metastasize. It usually is a locally infiltrative growth, and surgery in which usually we prefer a wide local excision with a margin of 2 millimeter to 1.5 centimeter. This is the usual margin that we take if we perform a surgery. And another upcoming treatment modality is Mohs micrographic excision. This can be done by either a surgeon or a dermatologist who has been trained for dermatological surgeries. In Mohs micrographic excision, we take the surgeon excises 1 millimeter margins. It requires good coordination between the surgeon and the histopathologist, since this small excised parts of the tumor are sent for a histopathological examination, and a first frozen section examination is done to see if the excised part is free of the tumor or not. Once the excised part is free, then we can terminate the surgery. This helps to reduce the excised part and also improve the this helps to reduce the excised part and also improve cosmesis. Also, it is preferred in cases like where there is a high risk histopathology, when it is near a vital structure like a nerve, and also in cases of recurrent tumors. So thank you guys. I hope you like the video. Please like, share and subscribe. Thank you for watching.